The title of our poster is Aromatherapy to Reduce Perioperative Nervousness and Improve Patient Satisfaction in the Perioperative Unit. Preoperative nervousness or anxiety is a common experience for many patients. Anxiolytics are often used in this setting to calm patients preoperatively, but few non-pharmacological approaches are available. Several recent studies show that lavender-based aromatherapy effectively reduces preoperative nervousness in adults, but its efficacy in the pediatric population remains unexplored. Thus, the purpose of this study was to evaluate the effects of aromatherapy in reducing preoperative nervousness and increasing overall patient satisfaction with the perioperative experience. We asked 3 research questions. In a sample of adults and pediatric patients aged 12 to 17 undergoing surgery, 1. Is use of aromatherapy associated with reduced preoperative nervousness? 2. What is the usefulness and acceptance of aromatherapy in the preoperative setting? 3. Do patients' level of satisfaction with nurses' concern for comfort improve post-intervention? We used an observational one-group pre-test, post-test design to answer our questions. We recruited and screened patients for eligibility during their pre-op visits. On the day of surgery, we assessed vital signs and level of nervousness before and after the aromatherapy intervention. The intervention consisted of applying a commercially available aromatherapy patch outside the patient gown. After a 20-minute exposure, we reassessed vital signs and nervousness. We also asked several questions about how much they liked the scent, how much it helped to calm them, and how likely they were to use aromatherapy in the future. These items were assessed on a 0 to 10 visual analog scale. Approximately 24 to 48 hours after the surgery, nurses conducted follow-up phone calls to assess the patient experience. During this call, patients were asked to rate their level of satisfaction with the nurse's concern for their comfort using a visual analog scale. The sample consisted of 100 patients, which included 81 adults and 18 children. The sample was 65% female and 75% white. All participants provided informed consent or assent, with consent provided by parents or legally authorized representatives for the pediatric patients. The results indicated that a 20-minute exposure to aromatherapy was associated with statistically significant reduction in the level of preoperative nervousness in both adults and children. Adults showed a 2-point decrease and children showed a 3-point decrease in nervousness on a 10-point scale. For both age groups, this represented a change from moderate to mild nervousness. For adults, aromatherapy was also associated with significantly lower systolic blood pressure and heart rate after 20 minutes. We did not see this effect in children, possibly due to the small sample size for this age group. Our second finding was that immediately post-intervention, participants rated their perceptions of aromatherapy positively. The majority of participants, 67%, reported that they liked the scent of the aromatherapy very much, which was a score of 7 or higher on the 0 to 10 visual analog scale. 49% reported that it helped them feel more relaxed very much, and 70% reported that they were highly likely to use aromatherapy in the future. Our third question pertained to patient satisfaction. In post-surgical phone calls, 96% of adults and 82% of pediatric patients or their proxies reported that they were very to extremely satisfied with their perioperative nurse's concern for their comfort. Although not shown in the poster, this was a big increase from the quarterly reports on patient satisfaction in the perioperative unit. In conclusion, short-term use of aromatherapy in the pre-surgical unit was associated with statistically significant reductions in level of anxiety, systolic blood pressure, and heart rate. The intervention significantly reduced preoperative anxiety levels in both adults and pediatric patients. Aromatherapy was well received by patients, with the majority reporting that they liked the smell, that it helped calm them, and they were likely to use it in the future. The results of this study support the use of aromatherapy to reduce preoperative anxiety and nervousness and to support patient comfort. Aromatherapy is an easy-to-administer, non-pharmacological intervention that was well received by patients and promoted patient satisfaction with the overall perioperative experience.